Hello, my friends. This is Dr. B, the best doctor you can find in medicine. 30 plus years of experience. Dr. B today wants to talk to you about the relationship between all this nasty gum disease, right, gingivitis, and all this plaque that you have at the base of your teeth, and a heart attack and a stroke, right? I mean, it's crazy. A patient just last week at our cardiovascular clinic, right? I work in a cardiovascular clinic. We specialize in the diagnosis and the treatment of heart disease and all the diseases of the blood vessel, whether arteries or vein. So the patient asked me, hey, Dr. B, I don't understand, why is it that when we have abnormal teeth, bad teeth, right? When we don't clean our teeth on a regular basis, when you have gum disease, gingivitis, right? Inflammation of the gum, when you will have all these plaques, what's the relationship between that and having a heart attack or a stroke? Very good questions. So I wanted to explain to you quickly that relationship. You see, in our mouth, in our nasal passages, in our ears, right? In the vagina of a woman, in our intestine, in our esophagus, in our throat, in every body cavity, natural cavity, we have billions, trillions of bacteria, right? Bacteria. We call them in medicine or biology, we call them commensals. Means bacteria that live normally in our nasal cavities, our ear canal, our mouth, our intestine, the vagina of woman, right? These are not cavities that are sterile. They are colonized naturally by billions and billions and billions of bacteria. We call them commensal bacteria. So in our mouth, we have billions of bacteria that live naturally, right, in our mouth, right? That's their habitat, right? Those bacteria, there are a group of them that we call streptococci, right? Plural of streptococcus. It's a genus of bacteria, right? And they have a species that we call viridans. So the name of that bacteria, or those bacteria that live in our mouth, among millions of others, are Streptococcus viridans, the Latin name, right? These bacteria love to inhabit, to dwell, to live in the plaque, dental plaque. This freaking plaque, this plaque that is at the base, right, of your teeth, right? They are in this little groove that surrounds the base of your teeth and your gums, right? We call that the gingival sulcus, right? Your tooth is surrounded like that by your gums, right? And there's a little groove between your gums and your tooth. This is your tooth, and here is your gum, right? Your nice pinkish gum. There's a groove between these two, right? Those bacteria and the plaque, they love to live together into that groove all around at the base of your freaking teeth, right? So when you allow plaques to accumulate around the base of your teeth, all over your mouth, right? That plaque is going to be colonized by this genus, by this type, by this strain, by this species of bacteria that we call Streptococcus viridans. These bacteria, they love that environment, right? They proliferate, right? Now, if you don't go on a regular basis on a regular basis. I go every 3 months to clean my teeth at my dentist, right? Usually they recommend every 6 months. But because I drink coffee, which is very healthy, and tea, coffee and tea can darken your eyes, your teeth. So I go to clean my teeth to make them nice and shiny, in addition to remove the plaque. So I do it every 3 months. So like this, the stains of coffee and tea, which are very healthy, by the way, go away because the dentist or the dental hygienist are cleaning those teeth. At the same time, they remove the plaque with their tools and their skills. They remove the plaques at the base. So they get rid of that plaque, and therefore they get rid of these bacteria that are colonizing, dwelling the sulcus, the groove between your teeth and your gum, and then you have healthy gums. If you don't do that on a regular basis, those bacteria are going to proliferate from your gums, right? They're going to pass into your bloodstream. Remember that your gum, you see the gum, right? They are red, pinkish. Why are they pinkish, right? Like my tongue, huh? Like your skin here, you see, huh? If you press, the blood disappears because the gums are very vascularized, right? They have a lot of tiny little blood vessels that come to feed the gum and to keep your gums healthy, right? So the bacteria of those plaques are going to pass from the plaque to your gums because your gums are infected. Your gums are not healthy, right, because of that plaque. So your gums are breaking down, and it's easy for those bacteria to go into your gums and go into the blood vessels, the tiny little blood vessels of your gums. From there, they're going to pass into your circulation. So these nasty bacteria of the group Streptococcus viridans, what do they do to your blood vessels? They create chronic inflammation. Chronic inflammation of your blood vessels over the course of many years gonna accelerate the deposit of plaques of atherosclerosis, this little gooey that accumulates, this gooey made of calcium and cholesterol plaques that accumulates in your blood vessels, right? So as time passes and more bacteria pass into your bloodstream and create inflammation of the lining of your blood vessels, more and more plaques of cholesterol and calcium, plaques that we call plaques of atherosclerosis, accumulate in these blood vessels, and with time they're going to plug, obstruct, make them narrow so blood cannot pass anymore, right? So that's the relationship between having lack of dental hygiene, right? Not brushing your teeth nicely, right? Not going to the dentist to clean your teeth on a regular basis to get rid of that plaque and therefore these bacteria. That's the relationship between gum disease, plaque, right? Bacteria in your mouth, and the increased risk of heart attack and stroke. Because these bacteria, again, gonna cause inflammation of your vessels because they pass from your gums into your general circulations. They go into the vessels, blood vessels of your heart and your brain, your kidneys, your liver, everywhere. And especially in the heart and the brain, they accelerate the deposit of cholesterol and calcium, this little gooey, fatty gooey that we call atherosclerosis, inside the blood vessels. And over time, over many years, a few decades, 10, 20, 30 years, eventually by the time you reach 50, 60, 70, whenever the cat so it is, depending on people, right? You're going to develop a stroke or a heart attack. So one of the best, most important way to prevent the deposition, the deposit of atherosclerosis, this gooey into your blood vessels, is to brush your teeth regularly after each meal, all right? And also to go see your dentist at least every 6 months. I do it every 3 months because in addition, I eat a lot of coffee and tea, which is extremely healthy. No caffeine after 12 o'clock, right? So I get all these stains in my teeth, and I don't like that, right? I want to have nice, beautiful, clean, white teeth, right? So this is the explanation that I gave to my patient, and this is the explanation that I give you, so that you understand the relationship between having gum disease, having plaque, not going to the dentist regularly, not brushing your teeth regularly, and the future risk that is huge of accelerating atherosclerosis deposition, deposits gooey inside your blood vessels, making them narrow and obstructed. Blood doesn't flow anymore. You develop stroke and a heart attack, right? This is the relationship. Guys, Dr. B is here with a massive amount of medical knowledge and scientific knowledge, biology, biochemistry, physiology, anatomy, molecular biology, cellular biology, blah, blah, blah. In order to, I want to pass on this knowledge to you in an easy to understand fashion. My channel is not about giving lectures to medical students, doctors, blah, blah. My channel is for you, the average Joe, the average Jane, whom I love, who are my patients, and to whom I want to pass on my knowledge in an easy, understandable way, so that you can go home and age gracefully like Dr. B. Stay away from cardiovascular diseases, cancer, strokes, heart attack, kidney disease, liver disease, and all this nasty stuff that you can get, right? Read my watch my videos. The tips that I give you are invaluable. I explain everything to you in an easy way. Dr. B is not here for the money, the fame, or the glory. Believe me, I make enough at the clinic where I work 8 to 10 hours a day, and I love it. I get a lot of fame and admiration and love from my patients, and I love them back too. I'm here because I need to pass on my knowledge. I'm here because I get pissed to see so much misinformation and disinformation online, on everywhere online, not any specific website, everywhere. People who are just want to sell you stuff that are just crazy, that have absolutely no scientific backing. People who want your money, guys. Dr. B is not here to sell you any garbage, any fake stuff. Dr. B is always honest with you. Please put your comments and question down there. I love you. I will get back to you regardless of your gender, ethnicity, politics, religion, skin color, blah. I don't give a cut. So I really do care about you, and I'm always available. I will get back to you. It might take time because I'm so busy with my work at the clinic. In addition, I need to sleep 9 hours a night to be fresh and smart and everything. I need to exercise 2 hours a day to be strong and good and age gracefully. And God willing, you do the same thing with my recommendations, and follow my recommendations so that we can age gracefully together. I love you. I give you a big hug. God willing, I talk to you in my next video. Bye-bye.